Ooh, these are brand new mugs. Would you like, we got one for you too. You can have a mug.
No,
Here you
was someone drinking out of this? I'd hate to have someone else's water. It's
No,
not very
that's it.
COVID.
We have a bunch of new ones for you. Yes, we're Dr. Alan Law is here. You know, this Halloween, do not fear the root canal. Doc is here. He's an endodontist, president of the American Association of Endodontists. Okay, let's break this down first and foremost. What exactly is an endodontist and how is it different from a dentist?
Thank you. Well, an endodontist is a dentist. We've been to 2 years at least of residency beyond dental school. So we specialize in treating and saving teeth.
Okay.
And we learn how to use new technology like three-dimensional imaging, x-rays, and surgical microscopes so we can see the intricacies inside the tooth. And we learn how to get people comfortable and do root canal treatments.
Okay, so you were saying and telling our viewers, hey, root canals, not scary. It's scary. If I get told I have to have a root canal, I'm like, oh, you know, just to think of the drill and the zzz. Okay, so take us through why it's not scary.
Well, thank you for that lead-in to make root canal treatment seem less scary. You know, I get patients every day that are scared, they're anxious about getting root canal treatments, and those are my best patients because, first of all, they set the expectation so low for me, I can usually exceed that expectation.
That's a
but
plus.
Root canal treatments are very comfortable procedures. We spend a lot of time during our residency learning how to get people comfortable with local anesthetic and keeping them comfortable during the procedure. We learn techniques that make it more efficient, and patients do really well. So it's the media that paints root canal treatments as being uncomfortable.
Oh,
but
he's blaming us. I see.
Well, sorry, it didn't come across that way. But people come in with a lot of infection and pain, and it's our job to get them comfortable. So root canal treatments actually relieve pain rather than causing pain.
And what can somebody anticipate? Like if they're told they have to have a root canal, how long are they going to actually be in some discomfort?
Well, the typical root canal treatment, you're going to get a diagnosis to make sure we have the right tooth and we're doing the right treatment, and then you get numbed up.
Okay.
And then the actual treatment can take anywhere between 20 minutes to an hour, depending on the complexity of the treatment. And then afterwards, you can expect it to be a little sore for 2 to 4 days, but most of that discomfort is controlled by Motrin, Advil, sometimes in combination with Tylenol. It's really a very comfortable procedure, and most people are much more comfortable afterwards than when they came in with a lot of pain.
Okay.
So you can do that if you need to.
There you go. I love to hear that. Okay, not too bad. Let's talk about the Halloween holiday upon us. We're going to be eating a lot of candy. When my daughter brings home, I'm like, oh, I got to sort through this and make sure everything looks good. And then I'm eating some candy. So what should we avoid, and how can we really be taking care of our teeth, especially during these holidays? You know, we like to indulge lots of sweet treats.
Well, first of all, avoid the hard candy.
Okay.
There was just a survey that came out from the American Dental Association that said 63% of dentists are seeing more cracks in teeth as a result of COVID, so grinding and clenching. So you don't want to make it worse by eating hard candy.
Sure.
And the other part of that is you want to avoid eating candy throughout the day, because every time you eat the candy, the sugary sweets feed the bacteria, you break down your teeth, and you're more likely to get cavities. So if you're going to eat them all at once. And then brush your teeth, and then go on to whatever else you're going to do.
So like go big or go home. Do it all at once, but not like throughout the day.
Don't eat all of your candy, but if you're going to have some candy, have it all at once.
I love that. Okay, so where can everybody find more information, learn about you, and find you? And if they really want to get in on this.
So to learn more about the safety and the comfort of root canal treatment, you can go to AAE.org. That's the American Association of Endodontists.org. Or you can go to findmyendodontist.com, and that's a way to find an endodontist in your area that could do your root canal treatment for you.
Fantastic. Dr. Law, thank you so much for being here.
You are welcome.
Can I ask a personal question?
Sure.
How are you with holiday budgeting and spending?
You know, I just heard your next segment was on that, so I'm actually pretty good.
Nice.
I could probably do a little bit more, my wife would tell you.
Okay, if you need tips or tricks